Hi, everyone. I think we have a good group already, and I am mindful of the time. So I would like to thank everyone for joining us today, and I will pass it off to Dr. Michael Van Rijn and Dr. Irini Albanti to start us off.
Hi, everyone. So thank you for joining, and I'm really delighted to see everybody joining us today, and especially delighted to see our wonderful faculty and staff and people who run really the wonderful programs we have at HHI. Just as an introduction, the Harvard Humanitarian Initiative is a university-wide program at Harvard University, and we really engage closely with our partners in the humanitarian space to really make changes and improvements in the humanitarian environment based on evidence and as well as leadership development. So what you hear today is just an overview of some of the wonderful programs that we have and the dedicated faculty and staff that really run these programs. So I'm really honored to introduce it. I'll turn this over to Dr. Irini Albanti, the Executive Director of HHI, for intros, and look forward to hearing the presentations. Thank you so much.
Thank you, Mike and Sabrina, and thank you, everybody. Good morning or good evening, wherever you are in the world. I would like to welcome you to HHI's Global Open House. We are delighted to have more than 100 people registered to join us from 100 different countries around the world to learn more about HHI's work. We designed today's session to give you a quick high-level introduction to HHI. You will hear from my colleagues who will talk about their research and education activities, which cover a wide range of themes from leadership training, gender rights, non-communicable diseases, children in crisis, community resilience, and more. I invite you to join our website, get on our mailing list, and stay connected. Well, welcome again and enjoy the session.
Great. Thank you so much, Irini and Mike. So one of the main things that we get as questions is, how can I get involved with HHI? So there are several ways that you can get involved, whether it be a professional opportunity or a student opportunity. Throughout the year, we offer, our programs offer several internships and practicums for graduate students. And I encourage everyone, if you're interested, to scan the QR code or to go to our website and hit the Join Our Team tab, and to look frequently as we do post different positions throughout the year. I do also want to encourage our attendees today to use the Q&A chat function at the bottom of your screen to insert any questions that you may have throughout the duration of the program, and our team members will assist and answer all the questions that we can. Great. So moving into our presentations, I'd first like to pass it off to Hoffman, who is the program manager for the Humanitarian Academy.
Thank you, Sabrina. Appreciate it, and welcome everyone. Good morning, good afternoon, good evening, wherever you are logging in from around the world. As Sabrina mentioned, my name is Hoffman, and I manage the educational programs at the Humanitarian Academy at Harvard. I'm just going to give you a high-level overview of what the Humanitarian Academy has to offer, and then kind of taking a focus a little bit more into the humanitarian studies concentration. So the Humanitarian Academy at Harvard, it offers 3 strands of training: the professional education courses, which are offered to executives, practitioners around the world, really emerging leaders, so to speak. This is to maximize impact in the humanitarian work that they do. We also offer online education, a suite of free courses to practitioners and students around the world to basically give them an idea about the fundamentals of humanitarian response. And then the third strand is also offered to Harvard students. This entails mainly the humanitarian studies concentration that they can opt into. And then also other opportunities to get involved. So be it the Humanitarian Students Association or applying for research or practicum grants. With that, I'd like to give you a bit of an overview of the Humanitarian Studies concentration. This is managed by the Humanitarian Academy, as I mentioned, and the Humanitarian Studies concentration is open to all Harvard graduate students. There's a curriculum that is integrated and it leverages the academy resources, and that the resources entail experiential and hands-on learning opportunities. It also provides research funding opportunities and faculty mentorship. The competences that the concentration offer, so by the end of basically ending or finishing the concentration, you should have a very good knowledge base about the frameworks, the principles, the analysis, and the assessment within the humanitarian studies field. The other competences entail project and team management, communication, collaboration, coordination. There are also other areas that go along side by side with the humanitarian studies field, and those include safety and security, and then also areas that the humanitarian studies concentration touch on include leadership, negotiation, and strategic planning. In terms of the requirements of the humanitarian studies concentration, there are 4 courses that students are required to complete. That adds up to a total of 8.75 credits. And by the end of the semester or the academic year, students are going to get a certificate that is issued by the Humanitarian Academy. Of course, students are also required to fulfill and complete their respective master's or doctoral program. The application process is pretty straightforward. Students just fill out a form that is available on the website. I've provided a QR code that I'll be happy to share that later as well. But once you're a graduate student, you're automatically entitled to apply and show your interest in the humanitarian studies concentration. What sets it apart is this is open for all graduate students at Harvard. So you don't have to be a student at the School of Public Health. You could be a graduate student at any other school at Harvard. And then the outcome, as I mentioned, there's a certificate. There's also a big plus, which is all the career and networking opportunities that students can take part in while they're doing the humanitarian studies concentration. And then finally, there's also opportunity for grants. Every year, students can apply for a grant to do research and practicum while in the humanitarian studies concentration. With that, I am going to pass it back on, and I'll be happy to answer questions in the chat while they come in.
Great, thank you so much, Hama. So I will now pass it off to the next presenter, being Silva Brink, who will represent the non-communicable diseases program.
Thank you, Sabrina. As she just said, my name is Silva Brink. Thank you all for joining our open house. We're very glad you're here. I'm an endocrinologist at Brigham and Women's Hospital and lead this NCD program with 7 in 10 deaths globally now being due to non-communicable diseases, of which 80% are in lower and middle income countries, same areas that host the majority of humanitarian crises. We want to address NCDs and improve care and ensure continuity of care in humanitarian crises. And our key project is coordinating the so-called International Alliance for Diabetes Action, or IATA for short. IATA is an alliance of over 60 organizations from various sectors around the world that are collaboratively working together to improve diabetes care in humanitarian settings. Obviously, it's a complicated issue and requires many actors to make progress here. And so we've categorized our work into these 4 working streams: improving access to medications and diagnostics, improving clinical care and operational guidance, improving data and surveillance, and then finally advocacy, policy, and financing. And different organizations are part of these different working groups. We have a team of 10 people that are co-leading these various working streams. And you'll see here a variety of projects that are ongoing. Currently, these are just a select few. For example, improving diagnostics, continuous glucose monitors, regular glucometers, A1Cs, looking at thermostability of insulin, improving educational materials, providing open access materials for people living with diabetes and providers. We have done some research, currently have a clinical trial ongoing looking at different types of insulin in lower and middle income countries, and doing advocacy with the World Health Organization and others. So there's a lot going on, a lot that you can get involved in if you'd like. Of course, happy to answer any questions. My email is below here on the slide, and our program manager, Anna, you can also contact her if you have questions. And I just wanted to flag, we have an upcoming symposium on diabetes in humanitarian crises. It's our third symposium, which we'll be hosting at the end of October in Krakow, Poland. Anyone is welcome to come and in person or virtually. So thank you very much, and I'll hand it back over to Sabrina.
Great, thank you so much, Sylvia. And I have put the link to register for the symposium in the chat. I will now pass it off to Kalyn and Lexi, who will be representing the Children in Crisis program. And just a reminder to all attendees, if you have any questions, please be sure to put them in the Q&A button at the bottom of your screen. Passing it off to you, Lexi.
Thank you so much. So my name is Lexi Schmidt, and I'm the Assistant Director of the Global Health Program at Boston Children's. And the Global Health Program at Boston Children's collaborates with HHI to create the Children in Crisis program, where we work to address the needs of crisis-affected children in humanitarian contexts. So what's the problem? So why do we do the following? So 1 in 6 kids, or about 450 million globally, lived in a conflict zone in 2020, which is an increase from 2019. And the impact of humanitarian crises on children has reached catastrophic proportions, with 60 million children around the world displaced from their homes due to violence, poverty, or natural disaster. So because of their vulnerability, children are disproportionately affected by war, social unrest, disaster, and economic crises. So we work to confront the complex and unique needs of children whose lives have been upended by these situations, to understand and respond to children's unique needs in order to prevent, mitigate, and address these detrimental health consequences that arise. So how do we do it? Sabrina, if you could progress the slides. So from an operation, we have 4 program streams: operations, research, education, and policy and advocacy. So from an operations standpoint, we work to support NGOs, UN agencies, governments, and donors to respond to child health needs and emergencies more effectively by providing technical support, programmatic guidance, and monitoring and evaluation expertise. We also develop tools to aid field workers to appropriately assess the health needs of affected children, and technical expertise to inform and support pediatric and emergency healthcare initiatives across the healthcare continuum at any stage in response. So some examples of our work here is we work on the US-Mexico border and our trauma and resiliency program in Jordan to support the mental health needs of trauma-affected children. From a research perspective, our goal is to define the immediate and long-term care needs of children in acute and protracted crises, and to identify best practice interventions. So we do this by conducting operational and evaluation research on the effectiveness of health programs for children, systematic reviews on the health requirements of children in fragile contexts, and the state of healthcare delivery in these settings. Care approaches for, in war and conflict, as well as to define future priorities for work. We also do some implementation research, so which is my favorite, is I'm a nurse and by training and a doer at my core. So our research areas focus on infectious disease, working with the WHO's high threat pathogen team and MSF. We looked at biomarkers as predictors of serious bacterial illness, nutrition, emergency, trauma care and resuscitation, and mental health. From an education standpoint, We create and deliver subspecialty curricula to frontline healthcare workers, including neonatal nursing, general pediatric care, pediatric intensive care, pediatric emergency, resuscitation, and procedural training for doctors and nurses, as well as training for staff to support crisis responses, and professional education workshops, such as our upcoming pediatric clinical skills course. From policy and advocacy, so what our work does is we seek to influence government, UN, and donor efforts to deliver policies and practices to protect and promote the health and well-being in emergencies. So this includes inclusion and prioritization of child health and protection in emergencies, humanitarian access and respect for humanitarian principles, as well as, most importantly, no child left behind. So to ensure that the world's most vulnerable children are included in programming and policy. So to wrap up, we offer a range of professional opportunities to collaborate in any of these program streams. And we work with students to either support or supervise research or practicum credits, internship opportunities, peer publication or abstract opportunities, and to connect. If you see me in the hallways, I'm often at HSPH, so please say hi, as well as please reach out to Kalyn Bear, our program manager, who will put her contact information in the chat. Thanks, and back to you, Sabrina.
Great, thank you so much, Lexi. I will now pass it off to the Emergency Health Systems Program. So Catalina, you take it away.
Hi, everyone. Thanks for attending wherever you may be in the world today. I'm Catalina Gonzalez Marquez, and I'm the Associate Director for the Emergency Health Systems Program, also called EHS. We've had a really busy year, so I'm going to try to kind of squeeze everything down in 5 minutes. So briefly, our mission is kind of to strengthen emergency care delivery globally. We know that emergency care is offered formally in some countries, but informally in other countries. And it's a time-sensitive thing, any emergency condition. We know that the strength of emergency care systems directly impact how effective a humanitarian response can be. And we know that an effective humanitarian response involves fortifying those emergency care systems that are already on the ground. But I think also most importantly, the local voice and expertise needs to be present at all stages of emergency care system development and at all stages of a humanitarian response. You can kind of keep advancing, Sabrina. And so we've had a really busy year and have kind of been working around the globe. This is not an exhaustive list of all our projects. It's just kind of the ones that have kept us, I think, the busiest this year. So I think importantly, kind of looking at home, we've kind of done a lot of deep reflection into our own literature, our own research, making sure that we're doing things equitably and in a way that is really valuing the local expertise that we work in. And we do that through our Global Emergency Medicine Literature Review, but also our involvement in the Society for Academic Emergency Medicine's Global Emergency Medicine Decolonization Working Group, where we've actually produced a lot of papers looking at equity in power structures and in emergency medicine globally. We've also been working with the WHO, and this is mainly led by our colleague Morgan Broccoli, who is working with them on essential service packages in multiple countries, including Sierra Leone, especially in the context of universal health coverage, and also who has been working in multiple countries with the WHO to kind of roll out their emergency care toolkits. As well as a basic emergency care course from the WHO being taught in multiple countries by members of our team. We've had significant research development and faculty mentoring with the emergency medicine faculty at Sayashika Hospital in Kigali, Rwanda. We also, in Tanzania, have been active with the Okoa Maisha Save a Life program. This is a basic hemorrhage control course being taught to moto drivers throughout Dar es Salaam. We also have emergency medicine development in Nigeria with our colleague, Dr. Anuj Bogu. And our two biggest projects, I say, which have taken up most of our time, is a big collaboration with Care India, Boston Children's Hospital, kind of doing emergency system development strengthening in the Bihar province. And the one that I think we get the most questions about and is currently active in that we just sent colleagues over to Ukraine today, is our collaboration with International Medical Corps, Boston Children's Hospital, Global Medical Knowledge Alliance, and many other partners, including the humanitarian organization International Medical Corps, to teach 6 different trauma training courses across the clinical spectrum tailored to a conflict setting, specifically in Ukraine. And that's kept us quite busy this year, and looks like there's potential to expand many of our courses there, such as Stop the Bleed, or our CBURN course, which is looking at care for environmental, nuclear, radiological disasters. And if you can go to our next slide. This is just our team. For those at HHI, you'll see that we've doubled in size, probably to the doubling of our work. But we're a pretty strong team, pretty deep, and looking forward to hear from all of you who are interested in emergency health systems. That's it for me, and I hand it back to Sabrina.
Great, thank you so much. Moving forward, I will pass it off to Dr. Erica Nelson, who will be representing HUM-GEO.
Good day, everyone, everywhere in the world. Thank you so much for joining us. My name is Erica Nelson, and I have the pleasure of speaking on behalf of our team at the Humanitarian Geoanalytics program here at HHI. The first question I'm sure many of you have is like, what on earth is humanitarian geoanalytics? So geoanalytics, for those of you out there who understand biostatistics or epidemiology, really just takes humanitarian research and puts it in time and space. It is a spatial way of looking at the world and looking at these different variables, bringing together these different interdisciplinary teams, concepts, data in a way that allows us to really understand the stochasticity of the environments in which we're working. So what we do is we take geospatial data, so anything that's geocoded, and we utilize analytics to transform humanitarian research, inform programming, and create education through kind of a practical, effective, and ideally ethical application of these programs. Now, many of you may have heard of the Signal program as well. So the Signal program right now is nested underneath the Humanitarian Geoanalytics program. The Signal program specifically works to advance the safe, ethical, and effective use of information technologies by communities of practice for humanitarian rights and human security. So it fits firmly underneath that humanitarian geoanalytic umbrella, but really focuses in on human security, whereas HUM-GEO writ large, as you can see on the right-hand side of this screen, does a full plethora of things that kind of fall within the guise of the humanitarian landscape. So we kind of go through our mechanisms of research, education, and consultancy. From a research lens, we hope to really legitimize the field through academic products that span kind of multiple geospatial technologies. So we're talking not only maps, but also spatial epidemiology, spatial predictive modeling, time-space modeling, and then also the incorporation of remote sensing and satellite data that a lot of you are very familiar with. The idea is to become a node of expertise or a convener of the community of practice for the theory and methods of geospatial analysis within this humanitarian space. Ideally, the idea is to create impact for those communities with whom we are working, really thinking about not only organizational impact, how can they be more effective, but really leaning into this idea of population-based impact. So morbidity, mortality, perceptions of security, those sorts of things. We also create a bunch of educational products, really working with a lot of our local organizations to talk about spatial literacy, right? Exactly, like what exactly are we talking about when we talk about humanitarian geoanalytics? Why is it important? How can we add value to your community? We create courses and content for HSPH and HHI, but also for the community writ large, both on open source platforms, but also through workshops. And then lastly, we offer consultancy opportunities in order to provide the resources and the capacity that a lot of our partner organizations don't have. So for example, working with the International Organization for Migration, looking at the intersection between climate and migration, or climate conflict and migration. So as you can see here, On the right-hand side, as I said, we engage with multiple different content area within the humanitarian sphere. We actually have a story map that you can explore. We work in collaboration oftentimes with Esri on what they call the humanitarian hub, looking at different ways in which spatial methods can be utilized in this space. But here is just, again, a non-exhaustive list of how we've been utilizing spatial methods. So we look at everything from gender-based vulnerability in Rohingya refugee camps. We look at how to strengthen health systems in protracted and fragile crisis environments. We are spending a lot of our time right now thinking about how spatial methods can improve atrocity prevention decision-making. As I stated before, we look at climate migration or climate conflict and migration, and we're really deeply committed to the understanding that environmental and climatological variables deeply impact our humanitarian and our human space. So that's becoming increasingly prevalent in our work streams. So as you can see on the left-hand side of our screen, we have a lovely team of folk. It always waxes and wanes with our projects and our programs. But if you want to reach out to us, I believe Sabrina is going to share our HHI website address. Syra, you can certainly share the story map address and my email, and you guys can get in touch with us. We often have time and space for graduate students, for HSPH students. We also have the capacity to kind of build out little bespoke projects with people interested in dabbling in kind of the humanitarian spatial universe. So feel free to reach out, and we are very much looking forward to getting in touch with you in the future. Thank you.
Thank you so much, Erica. I will now pass it off to Jocelyn Kelly, who will be discussing the program on gender rights and resilience.
Good morning, everyone. It's so nice to meet you virtually. My name is Dr. Jocelyn Kelly, and I'm the director of the program on gender rights and resilience at the Harvard Humanitarian Initiative. So gender-based violence is the most common human rights abuse globally. More than 1 in 3 women have experienced violence in her lifetime, and men and boys are also impacted by gender-based violence. These risks are heightened and exacerbated in contexts of crisis and fragility, exactly the kinds of places that HHI does most of its work. The mission of the program on gender rights and resilience is to investigate and address problems related to gender, peace, and security in fragile states. And we have a number of goals. Firstly, to examine the unique vulnerabilities that can be exacerbated by crisis and conflict. And this includes vulnerabilities such as gender-based violence, human trafficking, economic exploitation and abuse, and other forms of violence. We also seek to understand the most effective ways to address these issues by elevating the voices of those most affected, who are, after all, the experts in their own context and the experts in their own needs. GR2's kind of mission supports HHI's overarching goals by continuing to build an evidence base and creating innovative, inclusive, and gender equitable programming in humanitarian crisis, which now more than ever is being acknowledged as a core and fundamental need in the humanitarian system. As we've all kind of learned and noted belatedly, but especially over the past few years, promoting equity, inclusion, and local voices is an urgent humanitarian priority that has not been fully acknowledged in the past. So we have 3 broad areas of research that many of our programs fall into. Firstly, we are really interested in looking at the nexus of gender, climate change, and conservation. And I think this priority falls really nicely within some of the programs that Dr. Nelson was just telling you about, as well as some of the other programming that you've learned about. You know, we used to think of classically, maybe decades ago, about humanitarian crisis as occurring in a specific kind of place and occurring during a specific moment in time. And I think sadly, one of the most striking things about acknowledging our climate fragile future is that in some ways, the whole world is becoming a humanitarian crisis through a lot of these extreme weather events and the other impacts of climate change. And again, sadly, it's not time bound, right? So this is something that we're all going to be dealing with in the decades going forward. So GR2 is grappling with some of those realities and has really worked very hard to do evidence-based programming, again, working with extraordinary grassroots human rights defenders in some of the places that are on the forefront of climate change to think about how to address a lot of the climate-based vulnerabilities through women's leadership. So an example of a program like that is that we're lucky enough to be part of USAID's Resilient and Inclusive and Sustainable Environments Challenge, where HHI partnered with grassroots women's NGOs in Eastern Democratic Republic of the Congo. And we worked together to create a climate curriculum that highlighted the interconnections between human security and environmental security. And what we saw over the course of developing and implementing that curriculum is that not only did we see actions that aim to protect the environment increase, we also saw violence against women and inequity decrease. And that provides us really kind of, rare moment of hope and promise that tackling the issues of climate change and violence might actually provide more effective responses than addressing these problems on their own. The second kind of area of research that we have focused on is promoting equity in humanitarian programming through evidence-based practice. So we had a long-term and wonderful collaboration with UNICEF, where we worked really hand in hand with both the United Nations, UNICEF, and the humanitarian system to say, how can we ensure that the way we organize humanitarian response is really listening to and adapting to the needs of those it seeks to serve, particularly women and girls who can be at higher risk of violence as part of humanitarian service delivery. And so through that collaboration, we've really worked to support equity in the system and to reduce risks. And finally, the last kind of area of research that we have always embraced and continue to work on is understanding the root causes of violence with an aim to creating adaptive, responsive, and locally based solutions to the kinds of violence that might arise during humanitarian crisis. So you're, very welcome to reach out to learn a little bit more on the HHI website. And I would just state that, throughout these three areas of research, GR2 really embraces a commitment to translational research where we really seek to have impact through these programs by working with, these extraordinary kind of grassroots human rights defenders all the way up through the highest levels of the international humanitarian system. And we're really looking forward to hearing from you guys in the Q&A going forward. Thank you.
Thank you so much, Jocelyn. I will now pass it off to Kofi Owusu, who will talk about the NNPHL program.
Hi, everyone. Thank you, Sabrina. Thank you all of you for joining us today. My name is Kofi Owusu, and I'm the program coordinator for the National NGO Program on Humanitarian Leadership. As you can see on your screen, I'll be presenting on a general overview of this wonderful program. So, what's our mission? NNPHL, we offer professional training to humanitarian professionals in hopes that they'll build their leadership skills and confidence to take on leadership responsibilities. And with this, they'll be able to improve the delivery of services to those in need of humanitarian assistance. And why do we do this? Just a quick story of one of our when we were screening applications, and to me that summed up to me why these leadership trainings are important. And so we came across one applicant who is a medical doctor and has responded to many emergency situations. And he said he was trained as a medical doctor, but over time his work in responding to emergencies have always been working with people, and sometimes it even goes beyond working, medically. And so, but he was never trained in this sort of soft and leadership skills. And so this training provides that opportunity and a professional skills for him to continue to lead. And for me, that is an important piece for a gap for us to fill as a leadership training. And then PHL is designed through a consortium that comprises of Harvard Humanitarian Initiative, where I, myself and Dr. Enzo Bolletino work, and then another organization, which is International Medical Corps, and then Concern Worldwide. So this program is funded by USAID's Office of Bureau of Humanitarian Affairs. And so it is free of charge, and it's open to mid-level professionals from non-governmental organizations and community-based organizations. And so to be able to get into this program, at least you should have an experience in responding to a humanitarian emergency situation. And so our course is structured in three main components. The first component, which is an online learning modules, which is usually a 3-month online learning. And then after that, we have an intensive 1-week in-person training. And then after that, there is a participant-led knowledge sharing exercise, where the participants also share the knowledge that they've acquired through the training with their peers, their colleagues, or the staff within their organization. That is after the intensive in-person workshop. And then the core of our course is centered around leadership, as I've said, primarily looking at adaptive leadership as a core, where we try to look at leadership as an approach where leadership is an activity, and that regardless of your authority or your position, you're able to exercise that. And we try to distinguish between challenges that are adaptive or that is technical. In this way, understanding that helps you to really see what type of solution that will be needed in addressing this type of leadership challenge that you may come across. And so we also touch on other management and psychological resilience, because many times working in the humanitarian situations, it's not only stressful for those who are affected, it is also extremely stressful for those who are responding to. And so we try to introduce our participants to some of these techniques and skills that is beneficial in terms of emergency response. And so that is the overview of what we do. Just to give you a quick background of what we've done. So over time, we've been able to train about close to 400 humanitarian professionals. They come across over 60 countries, from Latin America to Africa to Middle East, Asia, and we have a majority of about 60%, 70% of our participants coming from Africa and then the Middle East. And so we are really, really proud of that. There's also another piece of the training, the online training. Not everyone is accepted into this, the in-person and the online training. And so there's an open access training, which also touches on the same courses that we do in the in-person workshops. And so that is free. If you go to our website, it's there and you can really access that. And through that, a lot of people have been reached, close to 8,000 online users already there. So feel free to check that out. Just to really highlight on a few publications that has come out from this training, is that we've been able to work on 2 publications. One has been submitted for publishing, other one is also work in progress. So just to touch on one that has been submitted, this is an important information that we are adding to the literature. And this was looking at what NNPHL applicants consider to be the biggest humanitarian challenge that they face when they are responding to emergency situations. And so this is an interesting information. One, because looking at the literature, we never really came up with a lot of studies that had a sample size that we had. We are looking about close to 5,000 applicants outlining what they consider to be the leadership challenge that they have. And so we were able to analyze that, and we hope that it's going to fill a gap where we'll be able to at least have some data that is statistically significant, at least can represent a majority of humanitarian professionals, and then the challenges that they face. And in doing so, we hope that trainings and then leadership trainings and policy will be informed through this publication. And so, yeah, this is a quick overview of NNPHL. So if you have any questions, please reach out to me. Yeah, you can hit us on our website for more. Thank you.
Great, thank you so much, Kofi. I'll now pass it off to the Resilient Communities program.
Great, thank you, Sabrina. Hi, everyone. My name is Hannah. I am the program manager for the Resilient Communities program at HHI. And sorry, I'm really excited to be here with you today and share a little bit about who we are and the work that we do. So our research looks at disaster preparedness and response, climate change, pandemics, and other public health crises. And at the core of our work, we're really trying to better understand the factors that contribute to positive community resilience in the face of these challenges and find ways to support these factors and share learning. So we work with communities as well as at the local and national levels. Our team is based in Cambridge and in the Philippines, where we've been working since 2015. And some of the key activities that we have engaged in the Philippines include conducting a nationwide survey on household levels of disaster preparedness, a coastal communities case study, development of a resilience scorecard, and more recently, a survey of mental health practitioners' perceptions of barriers to care during the COVID-19 pandemic. Looking ahead, we have a lot in store for the next several years, so I'll just touch on a few of those projects. In the Philippines, we'll continue to develop the evidence base on factors that contribute to positive resilience, and we're in the process of launching a few projects that will do that. First, we plan to follow up with a second nationwide survey to understand how the evidence on disaster preparedness has changed since 2017, and particularly with the impacts of COVID-19. Second, we will be conducting exploratory research to better understand how communities adapt to and mitigate hazards in areas that also experience social conflict. So as part of this research, we'll be organizing a workshop in Mindanao that will provide a forum for researchers, as well as members of civil society and professionals in government and the humanitarian sector to exchange research findings and learnings on this topic and identify gaps in the evidence. And then finally, we will be evaluating the impact of an anticipatory action pilot for tropical cyclones in 2 different regions in the Philippines. And this project is in collaboration with UN OCHA and other partners at the UN. And then this year, we will also begin working in Nepal. One of our first priorities there will be to carry out a baseline assessment of household preparedness for disasters. And the governments of Nepal and the Philippines are already engaged in knowledge exchange, focusing on disaster risk reduction and preparedness. So we're really interested in exploring opportunities to further support knowledge exchange between these 2 countries and potentially through workshops and other platforms. And then lastly, we are exploring opportunities to work with local partners on the development of leadership training courses designed to support climate change adaptation practices and programming in both the Philippines and Nepal. So that's a quick snapshot of where our work is heading over the next few years, and we hope you'll continue to follow along and stay in touch. And Sabrina has shared the link to our program page in the chat, so if you're interested in learning more, please check it out. And I will share my email as well, so please reach out with any questions that you have. Thank you so much.
Thank you so much, Hannah. I have added your email and the program information to the chat. I will now pass it off to the Building Better Response Project with Roger and Karima.
All right, thank you. I am really enjoying hearing these presentations today. Even though I know what all of you do already, it's really great to hear. So thank you for that. And hello, everyone. Welcome, welcome, welcome to HHI. I'm so excited to have you joining us today. My favorite day of the semester, I might add. My name is Roger LeGrand. I'm the Instructional Design Manager here at HHI. It is a real honor to be able to introduce you to the Building a Better Response asynchronous course. BBR has been used as a foundational course by so many organizations over the years to prepare humanitarian actors to perform well in a range of disaster and conflict-related contexts. As an educator and instructional designer, I really value being able to contribute to such an important learning experience and mission, right? Those two things get lined up in BBR in a really unique way, really important to me. So let's get into this. The BBR e-learning course, the asynchronous course, is a training platform designed to provide foundation knowledge in humanitarian response in the areas of the international coordination system, humanitarian leadership, basics of funding and planning, and other areas that are essential and important to humanitarian response. The course consists of 6 units. You should sign up for them all, take them all. 6 units, foundations of humanitarian action, the international humanitarian coordination system, the cluster approach, planning and funding, international law and humanitarian standards, and complex humanitarian emergencies. That's all 6. Those who complete the e-learning receive a certificate from the Humanitarian Academy at Harvard. Now, we are actively revising the course, and we're very excited about it. All of our upcoming design choices are evidence-based in an effort to create the best possible learning experience. And I can, little detour here. In fact, we practice a learner-centered, evidence-based approach to curriculum design for all of our HHI courses, including and beyond the scope of BBR. So it's really a fascinating approach to developing humanitarian education. We're also developing a new learning experience design for BBR that will include an adaptive branching assessment, which is infused with formative feedback moments to help learners reach higher levels of comprehension and higher levels of knowledge retention. So that's our goal here with this new assessment model. BBR is funded by USAID and implemented through a partnership with the International Medical Corps, Concern Worldwide, and of course, the Harvard Humanitarian Initiative. The content for the e-learning was informed by consultation with more than 400 humanitarian actors from all over the world. Just amazing, right? I mean, 400 humanitarian actors from the field shared their experiences of working within the humanitarian coordination system so that we could create a course with exactly the kind of instruction that's required and being requested in the field. Fascinating, absolutely love it. The target learner for the group, the target learning group consists of humanitarian actors from various organization types, including international NGOs, UN agencies, the private sector, community-based groups in context, academic researchers, and including students in humanitarian studies programs. So everyone should be signing up. I think that covers everyone. You should all be signing up. The impact of the e-learning has been significant. BBR has so far provided e-learning education to approximately 85,000 learners worldwide. That's 85,000 humanitarian actors with more awareness of these topics, right? I mean, that's the goal. They've been these topics that have been identified by those 400 volunteers, right? I mean, the scope is just staggering. Sabrina, next slide, please. Thank you for that. The Building a Better Response staff consists of a team of very dedicated, passionate individuals. Dr. Mike Van Rooyen, of course, who you met already this morning on the team, and Dr. Fong Pham, our HHI leadership, as well as Mary Peck from IMC and Kirk Pritchard from Concern Worldwide. They make up the leadership of the Building a Better Response project and have all been part of the project since its inception, which is great. The operations management team includes many team members who contribute to the project management. And I see Karima's camera is on. You can, and she's waving, so you see who she is. Working on project management, we have finance management covered, contracting, all the way out to instructional design and learning management system development. So a big, passionate team. And I invite you to join us. You can enroll today. Buildingabetterresponse.org, and keep checking back for the release date plans for the revised version of the course, which you can find on our HHI website and through our HHI social media, notably LinkedIn. You know, I can't say enough about this. It's a fantastic program, really important. And lastly, I invite you to reach out to me directly if you'd like to discuss humanitarian education, adult learning theory, instructional design. My LinkedIn is right there. And I think Fong and Patrick are next. You don't want to miss this. They are sure to have a great presentation. I'll hand it over to you now. Thank you so much.
Great. Thank you so much, Roger. You also just introduced the next speaker, so I will pass it off to Patrick Brink.
There you go. Thank you for the kind words and setting up for what is I think the last part, the last hurdle the audience has to go through before we can have a discussion. So what I'll be presenting is more of a portfolio of programs, a series of activities that Fong, who is on this call, and I have developed over the last few years. We're both on faculty here at the School of Public Health and School of Medicine. And what we've really developed, what ties these projects together, is something that may seem very obvious now, but that 15 years ago when we started wasn't quite as common, was this very simple idea that engagement with persons affected or at risk of disasters and complex emergencies is important. The simple idea that this engagement leads to better, more efficient response, that when we understand needs, when there's dialogue, when there's trust, response can be much more effective and efficient. At the same time, there's this equally important commitment to evidence-based humanitarian action. The idea that rigorous evaluation, rigorous research can and should inform action so that we can improve over time. The reality of the field, the challenge of the field is that we move from emergencies to emergencies, and that at times the space for learning is constrained. And so again, two kind of strands of commitments, this importance of engagement and this importance of evidence-based humanitarian action. So what does it translate into in practice? Maybe the most obvious one is the entire portfolio of programs and projects that we have developed around evaluation and implementation science. This simple idea that especially difficult response, not individual project, but say, how does UNHCR respond to the Sahel crisis? How did UNHCR again respond to the Venezuela displacement crisis? How does WFP use technology in constrained environment? These are big evaluation questions, the type of research that we do here at HHI that really tackles kind of some of the fundamental challenges, big challenges that field actors are confronted with. And so we partner with small NGOs, large NGOs, international ones, national ones, to do these type of evaluation and really formative evaluation that we work hard to make sure that the lessons are learned and that the process itself is very participatory so that it leads to changes and progressive improvement in how responses are made. But these evaluation kind of suppose specific interventions, projects are happening. We are also really interested in how communities themselves rebuild after violence. How does social cohesion come back in complex emergencies, in complex conflicts and various forms of violence? You know, what is the role of accountability and justice when you have mental health issues, when you have trauma? How does that come into play in societies? And so we've developed a series of projects across more than 20 countries now under the umbrella of peace and human rights data. And the idea is really to take the region, the society affected by conflict, and build over time a knowledge base of what have people experienced. How does it affect them? What do they see as the way forward? What do they see as some of the solution to build lasting peace, for example? And in that process, we look, for example, at the role of security actors and trust and how peacekeeping missions are operating on the ground. Are they trusted? Are they not trusted by the community? And if not, why not? And again, using this data really for engagement. So it's one of the luxury of our position is one of relative neutrality around research and data, and then to be able to engage with actors around, okay, what can be done now about this? We know that in this context, people are not trusting the police. What does it mean? What can be done about that? And that work really has led to now a third area of work on social science around infectious disease. Many of you may know about, of course, you all know about COVID, but before COVID, there was a quite significant Ebola outbreak in Eastern DRC, of course, when West Africa before that, but the one in Eastern DRC was really an important one for us in terms of transforming a lot of the research that we had done under peace and human rights to understand better how misinformation, rumors, how mistrust of state actors, how all these things come into play into impacting how people behave, whether they accept or adopt protective behaviors, whether it helps respond to emergencies. And I know I'm out of time, so this gives a brief overview of what we do on the data side. But in order to collect this and generate this knowledge using participatory methods, we had to work on tools, we had to work on process, and we've developed a number of participatory approach, but also a strong interest in technology. And so we've two major programs, one Kobo Toolbox, which is a free data collection platform that we've developed, Fong and I, in order to facilitate data collection process, and the Data Pop Alliance, which is really a think tank type of space to think about new ways of collecting data, big data, sensor data, social media, and how can these be leveraged. I know I went a bit over time, but in fairness, I present a number of programs. So thank you for your patience with me. And now on to the discussion. Looking forward to it. Thank you very much.
Great. Thank you so much, Patrick. So I am conscious of the time. So I would like, on behalf of the Harvard Humanitarian Initiative, I'd like to thank all of our attendees for tuning in. Thank you to all the presenters as well. And if you're interested in getting the latest on HHI's research, events, and more, please do follow us on social media and sign up to receive our newsletter. And if you have any questions, please feel free to reach out to the program directly. You can find their emails on our website or to the general HHI email, which is on your screen right now, and we will forward it to the appropriate team member. So with that, I would like to thank you so much for joining us, and I hope you have a great rest of your week.